we have Miss Richards, age 44. Her status post MVA, which is motor vehicle accident, and she's got a craniotomy. Patient intubated and on mechanical ventilation. Her ET tube size is 7.5. So a quick calculation would be to times that by 2, which is 15, and then go down to the lowest even number, which would be a 14 French size catheter. Her breath sounds are rhonchi throughout, which is indicative of secretions and of course the need for suctioning. The patient is ordered to be suctioned PRN, change patient to inline suctioning. Perform oral and inline suctioning, West size suction catheter, which we've already been through. Now I would go ahead and gather my equipment, which would consist of an ambu bag, the actual inline suction kit, saline to wash it out, and then of course medical socks and my stethoscope to do pre and post vital signs. So once I've gathered my equipment, I would go ahead, wash my hands and glove up. So we've already discussed that we have an order and that we have an indication for suctioning. One of the hazards would be hypoxemia, which is why we hyperoxygenate the patient before and after to kind of mitigate that risk. Alright, so I would enter the room, I would introduce myself and what I'm about to do to the patient and or the family if the patient is unable to talk or respond to me. I would go ahead, go in, I would check my 2 patient identifiers to see that I do have the right patient before I do anything. I would set up my pulse ox and listen to breath sounds. That's just to confirm that she is indeed rhonchorous and has a need for suction. Now, I'm going to go ahead and connect my ambu bag to a flow meter of 100% oxygen and turn up the flow until this bag is fully inflated.
I'm checking it to make sure it's working. It's working. Okay, I'm going to leave that running.
And leave that on a table or desk near the patient just in case. And then I would go ahead and put her vent on 100% oxygen. That will also automatically silence the peak inspiratory pressure alarm, so we wouldn't have to worry about that while we're just connecting and adding stuff there.
Before I even take them off, because I just want to be safe.
And once she's done hyperoxygenating, I can go ahead and disconnect and connect her inline suction.
It's gonna be for a minute, 30 seconds.
And then once that's done, I'm gonna go ahead and push my suction catheter through until I either hit resistance or she coughs. Right. And once that's done, I can pull forward slowly and occlude as I'm pulling out. I don't want to do this longer than 15 seconds at a time.
Want to just be very safe.
And then give her a little break between the first and second
Safe
attempt.
as possible.
Then again, I am pushing in until I feel resistance or she coughs.
Section for 15 seconds. So,
And then occluding as I'm withdrawing.
Mr. Brown, I'm going to run this tube down your throat. It's going to suction you. It's going to wait to 15 seconds, okay? You're going to have
And then, of course, I didn't put the suction on, but we are suctioning an adult, so we want to go anywhere between -120 and -150. And then once we're done with that, I would do post vitals, make sure that her breath sounds are a little bit less rhonchorous or clear. Make sure that her heart rate isn't super up, that everything goes back to normal before I leave her room. Make sure that she tolerated the suctioning well. And then I do want to go ahead and chart all of my pre and post vitals, how she tolerated the treatment, the color consistency and amount of the sputum that I got from the suctioning, and how many attempts it took.
resistance and you
I'm going to leave the ambu bag there with her just in case another respiratory therapist or a nurse has to come in and suction again. They have that all set up and ready for them. I would go ahead and clean the actual port in here of any sputum that got lodged in there.
I'm going to give her more oxygen.
And then I would go ahead and make sure that I stay here post oxygenating her. Make sure everything goes back to normal. Her cardiovascular status is stable before I do anything. And then I would wash my hands and leave.
So what